I'm looking forward to a brighter future. I'm moving ahead. I never stop for nothing. I'm looking forward to a brighter future. I'm moving ahead. I never stop for nothing. For this world where we live, people go come inside you like.
Hello, good afternoon, good morning, good evening, my beautiful people. Welcome to my channel. My name is Miriam K. In case this is your first time watching me, if it is, welcome. Consider subscribing and to get more videos, and also clicking the notification bell so you get notification anytime I post a video. So since January to this year 2020, all you would have been hearing is coronavirus, COVID-19, coronavirus, COVID-19, people dying. This is enough to just make you want to enter into your wardrobe and just do the sign of the cross, douse yourself in holy water and pray it does not catch you, because every day on the news is just who's died, who's dead, this person, this country, so many people have it, this is in lockdown, and you're just like, oh, it's coming, it's coming, it's coming. First of all, let's all just take a deep breath and calm down. Okay, so I wanted to do just a quick video about coronavirus, especially for people that are considered high risk, like myself, because of course I have a chronic condition, sickle cell, which causes me to have low immune system, and every year I get colds, flus, viruses, you name it. So I'm considered high risk. Not just people with long-term pre-existing long-term medical conditions or low immunity, but also like older people. I don't fall in the older category, but I definitely fall in the chronic condition, low immunity category, because I have a pre-existing condition. So I know there will be a lot of people like myself that are a bit worried. I live in the UK, in London, and as of today the 10th of March, we currently have 321 cases and 5 deaths. And that's the UK. The highest right now in terms of cases worldwide, there are a total of 114,000 plus people worldwide that have caught the virus, and out of that 114,000, over 4,000 deaths and 64,000 plus recovered. We have some breaking news. So as I was editing this video, the World Health Organization has now officially declared the COVID-19 coronavirus a pandemic. I know it's really scary and it's hard not to panic when even the word pandemic has panic in it, but we still have to just continue following the guidelines and precautions that have been presented to us, and we have to keep ourselves updated on what is happening. Now, since I did this video yesterday to now, the cases have now increased to 126,000 with 4,616 deaths. The virus has now affected 122 countries. The UK now has 456 cases with 8 deaths. So as the day goes on, things are changing literally by the hour every day. So my advice is to just keep yourself updated, follow the guidelines that's been given, and make sure you're listening to reputable news sources and keep yourself updated. So anybody, first of all, can catch the coronavirus. It doesn't matter whether you're old, young, sick, this, anybody can catch it. But those at high risk are more likely to get severe symptoms from it. And because obviously if your immune system is not that strong, then it's going to be hard for your body to fight it. And the worst thing with it, the coronavirus, COVID-19, is that there is no treatment for it, because this is a new virus that our body has not developed any immunity to, so that has been unknown to us. So there is really no treatment, cure, antibiotics that can help it. But there are things we can do to just try and reduce the rate of spread. There are certain things that we can all do, and things that we should be doing anyway, that I do, because, well, every year I'm at risk of getting flu, so, and colds and viruses and all those sort of things. So these are things that I already do, but it's a good thing that we all can do these things, and it can help. And for me, I would say it's about prepare, not panic. The thing is to just follow advice. Make sure you keep updated with news. And when I say news, please let me look at you straight. When I say news, please, I'm not talking about the news that people send you on WhatsApp or social media. I'm talking about reputable news website or sources, or governmental website. Like in the UK, if you want to get the latest information on corona and advice that are being given by professionals, health professionals and specialists and scientists, then you can visit the NHS website, call 111, or you can also there's also information on www.gov.uk. That's where you can get information, or NHS. You can also get information from the NHS.uk website as well if you're in the UK. It does give kind of overview of other places with cases and statistics. So those are the places that I'll say. So how does coronavirus affect people? What are the symptoms? Well, the symptoms, according to what has been seen, the symptoms are coughing, shortness of breath, and high temperature or fever. So it's hard, because these are symptoms that you get just with common colds. Like, I've always got a cold, I'm always coughing, I get shortness of breath. Sometimes when I have a crisis or when I have a cold infection, I also get temperatures every now and then, So it's so difficult, it's hard. Just because you coughing, you have a bit of a temperature or shortness of breath, doesn't mean, oh my god, I have the coronavirus, I'm gonna die. No, there are a lot of common colds that give you those sort of symptoms, or even other health issues that give you those sort of symptoms. So you shouldn't really much worried unless you have recently traveled from one of the highest heat countries like China, certain parts in China, and also South Korea, and then if you've recently traveled from Italy. In the meantime, what we can all do to help to just reduce the spread of it, number one and the most important thing is hygiene. Washing your hands with soap and water. That's the most important thing. When you go out, you come back home, wash your hands straight. Wash your hands with soap, water for at least 20 seconds. So you do that. Now what I do whenever the kids, I pick them up from school or I go out and come in, wash hands. Luckily for us, as soon as you enter into my house, you get to the toilet before you get to any other part. The toilet door is the first one, so we go straight in there in the bathroom to wash their hands with soap water for at least 20 seconds. So you just find a way to kind of implement that into your kids' daily lives. I also taught them about coughing, you know, instead of that now that it's better to either cough tissue and throw that away, wash your hands, or using your sleeves. So instead of your hands, it's better to do it like that. So I'm trying to teach them that. And also anytime they cough or sneeze, use it. If you use a tissue wipe, catch it, kill it, bin it, bin it, wash your hands, and that's it. So I make sure that they do that every time regularly. I have wipes and all of those things. And also, if you do not have soap and water, it's the best way. The next best thing is to use hand sanitizers. If you don't have, or if you're out and you don't have access to soap and water, then you can use hand sanitizers, the antibacterial one. And it's crazy because these are getting crazy expensive. These are things that I always had anyway. I have this in my bag. I have them around the house, in the kitchen, everywhere, because as I say, I'm always at high risk of this thing, so I have them. And what I also do is I have like the cleansing hand wipes. So when I'm out and I have no access to like water, I'll use the cleansing wipes, and then after that followed by the hand sanitizer. But the best way is soap and water. So these are the things right now we can really do to help reduce the spread of it, the transfer of the virus. But besides that, there are no antibiotics, no anything. Even if you do end up having really severe symptoms, you're in hospital, they can only treat the symptoms to try and help your body fight, but there's nothing that can be given to really treat you, you know. So even developing a vaccination is going to take some time. So we just have to do these things right now. And also when it comes to travel, I know there are a lot of people, summer holidays coming, a lot of people, Easter is even coming, a lot of people are traveling. So in terms of travel, as long as you're a healthy person and if you're not going to a place that is high risk or that has had many cases, they're saying that you should be fine. Just still continue to do these things even when you are. But if you are an older person, for example, you have a pre-existing chronic condition or low immunity, then unless important, I would say just kind of cut down, especially long haul.
So we have another breaking news regarding traveling. It is now being announced that Donald Trump, the president of the United States of America, has now suspended flights from European countries except for the UK right now. So this is a breaking news. So this is exactly for especially for those that are planning on traveling this Easter. It is really important that you get the latest information. Call your travel agency or the flight company that you booked with the airline. Contact them if you have booked any holiday and you're supposed to go there, because this might affect you traveling. So I just wanted to add that in because that just came out literally not long ago. Everything is changing by the minute, by the hour. Literally, this is getting serious.
Travel. The reason I'm saying this, especially with now the UK leaving the EU, I don't know how it's working right now when it comes to medical insurance or treatment outside of the UK. So I personally would not want to risk going somewhere, traveling right now that this is going on, and being somewhere where I would not be eligible to treatment, and then I might not even be able to come straight away into the UK in case of anything. So if you do fall into that, then maybe I'll say unless important, or Make sure you keep up to date with information of wherever you're going. Make sure you know where things are. Also, if you're traveling abroad somewhere far, make sure you know where the embassy is. You have all the right contact information, the right information. Speak to your travel agency before going. It's just really about taking precautions. These are things, as I say, I do all the time, regardless of a virus or not. So this is what we can do. So far, what we've seen, thankfully, Africa currently is not like highly hit with the virus. But then that does not mean it's not there. Testing facilities might be a reason why we're not seeing it quite high, because somebody needs to be tested for it to find out whether or not they're positive, they have the virus. If there's no testing being done, there are no cases. You understand what I mean? And even well-developed countries with good healthcare like China, Italy, the US, they are finding it difficult to make sure tests are available for people. So imagine places like Africa, where we barely have a health system, let alone the testing facilities. So even though, if you are traveling to Africa, even though right now we're not seeing like high cases there, I would still say take the same precautions, do the same things, take the same advice to just make sure you are doing the right things to protect yourself. And right now in Africa, the statistic today, 10th of March, South Africa, there are 7 cases. Senegal, 4 has reported 4. Morocco, 3. Nigeria, 2. And Cameroon, 2. So far, that's what we had. That's what I've had anyway, the statistics that are available right now for the cases as of 10th March 2020. But this might change as the tests get done. And the other thing with Africa, I don't, most of the time, especially like for where I'm from, Sierra Leone, there is no direct flight. So our flights always pass through we have to transit through other countries. So even as that, you still also need to take the same precautions. Make sure you always have hand sanitizers, gel, and all these sort of things. I wanted to talk about when it comes to like face mask. As I said, I am a high risk patient, and I've had viruses, of course, before anyway. As recent as not long ago, I had the one where I had to be in hospital in isolation, and anytime doctors come to see me, or nurses, for anything, they had to wear the mask. And when I needed to go out of my room as well, I needed to wear it to protect other people. So when it comes to, if you already have it, to prevent you passing it on to people, it's helpful. But wearing it around just everywhere isn't really going to make much of a difference based on what I have seen. And another thing I really want to talk about as well is taking everything you see on social media with a grain of salt, especially WhatsApp. I've received so many videos and audios and this talking about, even recently, that chloroquine, which is used for malaria, that they recently found that is basically a treatment for coronavirus. This has not been confirmed by any scientist or anybody. So please, whatever it is you see, go and cross-check it with actual reputable websites and governmental bodies or from specialists. Don't just take anything. I've even had things like drinking bleach. It's like, seriously, so anyway, so please be careful. It's not everything. I've even had them saying that it was manufactured in a lab or whatnot, and there's a law. Sometimes people get bored on social media and they use the situations to their advantage to just make people panic, get scared or anything. That's why anything I do get sent, I make sure that I check everything with the news, with reputable sources and governmental websites, I don't just start going with any narrative. So please be cautious about that, because it's everywhere. Social media is something we can't avoid. So you're gonna come across these videos, these voice notes, these messages that they're sending around. So please don't just go and do anything before checking it out. But just make sure you keep your area, wherever it is, your space clean, tidy. You know, constantly I'm wiping worktops every time I use them, cleaning up, and just things like that. And even the kids' toys, their books, I wipe them off, and just doing what we can. But at the moment, that's all we can do. So please don't go around working like this. This is not going to help you. Look at this, something that you, so please don't go around acting like this. That is a lot. We are not yet there. So please follow the advice, do what you have to do, and just calm down, follow the instructions from healthcare professionals. And also please be careful when you're buying stuff like this, because people are taking advantage of the situation and selling hand sanitizers for God knows how much, masks for God knows how much, because they are feeding into the panic. And as I say, people like to profit from things like this for no reason. So please just avoid going around walking like this, because people are going to be more scared of you than you are going to be scared of them. Unless told by a doctor, don't. Okay, so that's my advice for you for now. Just stay safe, and yeah, just keep following the instructions and do what you need to do. Anyway, that's all I have. I'll keep you updated. As I said, I've got more videos coming up, so make sure you subscribe, click the notification bell. I'll keep you updated if there are any more development changes. And that's all. Anyways, hope you enjoyed the video. You learned something. I'm learning as well as I go. I don't know it. I'm not a doctor, a scientist, or anything like that. So please, I'm only giving you information based on what I have read, what I've seen, the news, and all of that. So that is it. Have a blessed day, and until next time.